Welcome to On-Screen Learning. Explain the importance of verbal screening and how to conduct it. As a fitness professional, it is important that you verbally screen clients when they begin any exercise session. By asking a few simple questions, the fitness professional can make a judgment call if the client should proceed with the exercise commitments. Let's look at 7 screening questions that a fitness professional verbally asks a client. 1. Has your doctor ever told you that you have a heart condition, or have you ever suffered a stroke? People who had a history of cardiac issues, heart attack, or bypass surgery are well aware of their heart condition. Therefore, such people usually say yes to this question. However, that doesn't mean they require immediate medical attention or clearance. Depending on the present health status and the time since the last cardiac event, one can analyze a person's heart condition. Some people report that they have a heart murmur from a sufficient period. If a person doesn't have an underlying cardiac issue or cardiac history, the heart murmur is not harmful, and in most cases, they don't require any medical clearance. Contrarily, people who often experience chest pain or angina while having a physical activity like walking upstairs require medical attention or support. It is highly recommended that such people have frequent medical checkups to investigate their heart conditions. 2. Do you ever experience unexplained pains in your chest at rest or during physical activity or exercise? Chest pains are usually characterized by sharp, constricting, burning, and dull ache-like sensations. Symptoms of chest pain typically arise due to oxygen deficiency in the heart tissues. Deposition of fatty plaque in the capillary walls causes an artery blockage, which results in restricted blood supply to heart tissues and ultimately causes oxygen deficiency in the heart muscles. If a person feels such a problem, it is highly recommended that he seeks immediate medical clearance. Physical activity or exercise may worsen the condition as it increases the heart rate muscles' workload, and they require more oxygen to pump blood around the body. Partial blockage of a blood vessel is such a condition that may lead to a heart attack. 3. Do you ever feel faint or have spells of dizziness during physical activity or exercise that causes you to lose balance? Dizziness includes lightheadedness, vertigo, loss of balance, faint feeling, or floating sensation. Several underlying causes make a person feel dizzy. However, dizziness after physical activity or exercise is something that can't be ignored. People often complain that they think transient dizziness or lightheadedness immediately after they stand up suddenly. This is a normal body response to standing. Still, if a person experiences more dizziness episodes while walking, sitting, or even having mild physical activity, then a detailed medical checkup is recommended. 4. Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months? Medical attention refers to an acute medical care or treatment provided by a medical professional under critical circumstances. Asthma is a chronic and relatively common disorder with over 300 million cases worldwide. Its highest prevalence is recorded in Australia, where it accounts for 21.5% of overall cases. Mild asthmatic symptoms like coughing and wheezing not always indicate that medical attention is required. This question mainly refers to an asthmatic attack where a person experiences severe asthmatic symptoms like shortness of breath, chest tightness, suffocation, and inability to speak. In such circumstances, it is highly recommended to see immediate medical attention rather than performing a self-medication of asthmatic drugs like Ventolin or Becotide, etc. An acute asthmatic attack might lead to life-threatening conditions. Therefore, it is necessary to have some system that identifies the potential hazards of people having an asthmatic history. 5. Have you had diabetes, type 1 or 2? Have you had trouble controlling your blood glucose in the last 3 months? The inability of a person to maintain an average and stable blood glucose level refers to trouble controlling. This condition usually arises in diabetic patients who cannot control their blood glucose levels and suffer from hyperglycemic or hypoglycemic events. Hyperglycemia is a disorder in which glucose levels increase above the average level. According to the WHO, a person is suffering from hyperglycemia if his or her blood glucose levels remain above 7 millimolar per liter for several days or remains above 15 millimolar per liter for a single day. Exercise is often a useful therapeutic strategy for bringing the blood glucose levels within normal range. Typical hyperglycemic symptoms include dizziness, blurred vision, lack of concentration, general weakness, anxiety, confusion, convulsions, etc. Hypoglycemia is a health adversary in which blood glucose levels decrease below the average level. This is usually the result when the blood glucose levels drop below 3.5 millimolar per liter. Hypoglycemia is a more harmful and life-threatening condition as compared to hyperglycemia. Typical symptoms of hypoglycemia include palpitations, hunger, anxiety, dizziness, shakiness, and confusion. 6. Do you have any diagnosed muscle, bone, or joint problems that you are told could be made worse by participating in physical activity or exercise? There are several chronic conditions related to muscles and bones in which a person feels an acute muscular pain or aches, or even a bone or a joint problem. Such chronic conditions limit people's daily activities, and they are unable to take part in any physical activity or exercise. Arthritis is an example of a bone-related chronic condition in which a person experiences a severe bone or joint pain which exacerbate with time. Other such examples include spondylolysis, scoliosis, spondylolisthesis, Parkinson's disease, cerebral palsy, muscular sclerosis, bone fracture, joint dislocation, etc. 7. Do you have any other medical conditions that may make it dangerous for you to participate in physical activity or exercise? The final question of Stage 1 verbal screening refers to any medical condition or problem not discussed in any previous question. There are chances that a person might suffer from any medical condition beyond the scope of the items mentioned above and is affecting his or her daily routine life. Such conditions are not limited to hypertension, hypotension, balance problems, pregnancy, acute injury, cancer, epilepsy, etc. Summary: these verbal questions are essential for a fitness professional to take the consent of his clients. If your client answers any of the items mentioned above in yes, then it is better to recommend him to seek appropriate health guidance from a medical professional before involving any physical activity or exercise.